Scott County, providing safe, healthy, and livable communities.
Item 6.1, receive information on Scott County delivers topic, active lifestyles in parks. And you're saying that just as I felt my pants getting a little tight this morning, so this is timely, so thank you. Take it away, sorry, I know, interesting segue, right?
Yes, thank you so much, Mr. Chair and Commissioners. Today's topic is active lifestyles in parks, and this focus of this group was actually looking at it in regards to our changing demographics with a special focus on the aging population. This topic presents a wonderful opportunity to discuss the collaboration that we have across our Scott County departments, but it's also important to note that while counties play a vital role in shaping the environments that promote these active lifestyles, no county or any one single entity is entirely responsible for ensuring that residents have access to safe and meaningful physical activity. Creating a community that supports healthy aging requires a collective effort across sectors, local governments, nonprofits, healthcare providers, and residents themselves. To this effect, we are lucky to have Greg Boatman of the City of Savage here with us today. So special thank you to him and to everybody else for working so hard on this packet. I know that it is a lot of effort to get to this point, so sincere thank you to all of you and for our co-facilitators as well. First, I'll have our facilitators and then our panelists introduce themselves and share where they're from.
Hi, Julie Hansen, Property and Customer Service Manager here from Scott County.
Good morning, Brittany Lane, Director of Aging and Disability Services at Scott County.
Good morning, Nate Thomas, Design Manager and Transportation Services.
Good morning, I'm Greg Boatman, the Public Works and Parks and Recreation Director for the City of Savage.
Lisa Brodsky, Public Health Director, Scott County.
Patty Freeman, the Parks Program Manager for Scott County.
Casey Statue-Tudich, I am the SHIP, or Statewide Health Improvement Partnership Coordinator for Scott County.
Julie Jacobson, I'm the Community Program Coordinator with Scott County Library.
Good morning, Thomas Garicki, Strategic Programs Manager with Parks and Trails.
Great.
Thank you all. Greg, not to put you on the spot, but if you would like to address the board and share anything right off the bat, I encourage you to do so, or feel free to share during the conversation as well.
Great, thank you so much. Good morning, Chair and Commissioners. I just wanted to say thank you for having me here today. I think some of our opening statements were just so true. We can't do this on our own, and working collaboratively with our partners across the board and all the communities as well as the county has just been crucial in trying to provide active lifestyles, awesome opportunities within our parks, our programming that we provide to our residents in Savage, but again, all across Scott County. So thanks for having me.
Absolutely, thank you for being here. Commissioners, I'd like to extend an opportunity if you have any questions just at the forefront that help with the direction of the conversation. As always, you're able to jump in during, but just if you had any at the beginning.
Great, thank you.
Thank you, Mr. Chair.
Yes,
Thank you, Katie. Great packet, everybody. I read through it, and one of the questions that I struggle with as a board member sometimes on so much of this information is, what is the county's role? And you kind of talked about that already, all the different entities, but as we talk about things, I think that's really, really good, because some of the things are just interesting. And as a citizen, I want to know it, but what's the county's role? So as much as you can touch on that, helpful.
please.
I would like to hear about specifically adaptive programming that is being provided in the cities or the counties.
If anybody would like to answer that right now.
I can jump in. From a recreational standpoint, we define adaptive recreation as programs that are designed specifically for a specific population group. And in particular, a lot of the lingo that we use is for people with developmental disabilities or cognitive disabilities, and that we provide specific programming for them. In the City of Savage, we partner with many groups from around the metro area to provide programming because our community itself cannot sustain a whole registration group on its own. So we work together with Special Olympics, we work together with our partners in some of our neighboring communities to the north, but providing opportunity is really access for the City of Savage. So we provide access to the Dome, our sports center that we have, opportunities for people to participate in specifically designed programs that meet the specific needs of a specific group. So that's how we respond to that. In my career, I've worked in collaborations throughout many communities where adaptive recreation programs have been kind of the lifeblood of what we've done. In a former community that I worked in, it was part of this large collaboration, but I think it speaks to what we're here to talk about today, is collaboration is really the key behind anything we do providing these kinds of recreational opportunities.
I can jump in for SHIP real quick. Our program mostly focuses on policy systems and environmental changes, so more of the community design aspect of physical activity. However, we rely very heavily on our partnerships, both in the community and with other departments within Scott County, with both parks and libraries, who are both here at the table today, to put on a lot of that active living programming specifically. So a lot of the projects that SHIP specifically works on is more of that community design aspect, so working with school districts, childcare entities, work sites, different community partners to implement programming. I can talk more specifically about some of the projects that we have done in the past, but I'll kind of leave it at that for right now.
Thank you.
As for the parks, whenever we work with designing parks, we always try to make sure that we are making sure that they're accessible for those who move and communicate differently. Some of the things that we're doing within our programming is our partnership with Three Rivers allows us to access Three Rivers' larger adaptive programs and needs. So they have equipment that we can bring into Scott County upon request. But one of the things underneath the wellness grant that we've received from the Met Council is that we are starting to meet with organizations like PROACT, and we're hoping to offer some winter programs for those individual groups to learn more about what can we do and how can we do it better to reach these groups in the future.
And then I would like to add, with the library, we do like to, as we look at our programming, as we look at the way we provide resources to the community, we like to look at the community as a whole, but then as individual adaptive programming ideas. We will sometimes meet them where they are. We will also sometimes partner with different departments, parks, we've partnered with public health, and offering them spaces within our library system so that they can meet those different needs, whether it's adults with disabilities, it's the aging population, children, wherever. So that's kind of how the library partners with that.
Great. Thank you.
I'd like to talk a little bit about the role question that Commissioner Recchi mentioned. I just want to say that I think a fundamental role of the Parks Group is to really understand that the county has quite a bit of park infrastructure, a lot of investment in the infrastructure, and that we need to always be looking at in being strategic and making sure that everyone is aware of it and has the opportunity to utilize it fully. And we don't take that on. I don't think that's just a Scott County staff thing to take on. It's reaching out to partners and really being open to unique partnerships and how nonprofits and community groups can use our facilities. I think our shining example of this is our longstanding partnership with Let's Go Fishing. And without Let's Go Fishing, we wouldn't be serving, I think it's about 800 to 1,000 aging adults and folks with limited mobility at Cedar Lake Farm. So that's just one thing. I think that's a really big part of our role, is making sure that we're fully utilizing the county's infrastructure.
And on a very distant side note, I can't look at this guy without looking for my bait bucket. Do I have my pole? It's good stuff. All right, awesome. Way to get us started. Thank you.
All right, Julie, you can start with.
Sure, I'd be happy to get it started on this side. First, I'd like to echo what others have already said about your excellent narrative. You've provided us with an incredible amount of examples for opportunities for our residents, and I really learned a lot, so thank you for that. My first question that I had actually did refer to Let's Go Fishing. So in the packet, it's on page 4. You talk about the continued support of that. And I think, Patty, you've referred to what makes it such a valuable program, how you support it. Could someone maybe expand on what gaps they're filling that you're not really able to?
Do you care to take that?
Yeah. So, thank you for that question. So Let's Go Fishing is their own independent 501c3. So underneath that, this actually, for those who don't know, Let's Go Fishing is actually a statewide and nationwide organization. So we are just one small piece of the puzzle, but we are own our own 501c3. We're technically our own nonprofit that operates underneath Let's Go Fishing. So really what that allows us to do is it allows us to work with the home office to get better insurance rates. It allows us to buy the boat at a discounted rate. We can work on getting donations through them as well. And those are things that typically would be a little bit harder to do at a scale that's run just by the Parks and Rec Department. But one of the things that Let's Go Fishing really thrives to do is that we're really trying to reach out to volunteers and to people who have disabilities and give them no boat rides at absolutely zero cost. That's one thing that we've really prided ourselves in, and that we offer about 1,000 boat rides each year. And then when we work with the Scott County, one of the things that really sets us apart from other chapters is that we're actually able to store our boat on site. We have a facility that allows people to come and have a picnic out there at the facility as well, and really make this one little fishing excursion really more about, hey, let's go out to a park and experience and immerse ourselves in nature. And that's one of the things that's so valuable about our partnership with Scott County and Let's Go Fishing, is that we just wouldn't be able to provide that. Other chapters, they have to physically drive their boats to each of the lakes, but it's nice that we actually have a landing spot. So with that, we do have about 80 volunteers that we work with throughout our community that also helps deliver that experience, and all that is time and money that is all managed and run by Let's Go Fishing.
Mr. Chair and Commissioner, I want to mention that Thomas is also on the Let's Go Fishing board and used to be the director. So when he's saying we, it might be kind of confusing. Yeah. He was talking on behalf of Let's Go Fishing a little bit there, if you were confused.
Thank you for that.
Yeah.
We've talked a lot about collaboration today, which is really exciting. I think that's seemingly that's a really important part of carrying this work forward. I'm interested if you could share a more specific example of what collaboration between these groups. We've got parks, transportation, libraries. What does that look like as far as creating programs or spaces that older adults can benefit from?
I'll go ahead and get started, Chair, Commissioners. Collaboration is the very nature of what we do, whether it's through our professional organization where we collaborate with partners across the metro area, understanding what gaps are they filling for, especially our older adult population, gaining that knowledge, stealing, we call it stealing program ideas from each other, what works, what doesn't, that really helps us out. But specifically with the groups here, we work in the city of Savage, we work collaboratively with our library constantly, where we have programming that serves all age groups that come to, like our Environmental Learning Center, the McCall Pond Environmental Learning Center, which many of you probably are familiar with, or we work through our library location right in Savage, providing 55 plus transportation insurance groups, safe driving type programming, other types of programming that serves maybe kids, but their grandparents or their parents are coming along with them, and they're gaining that benefit of making those connections. I've had the pleasure of working alongside public health my entire career. In my former community, Lisa and I worked together, and then we're also coming out here now into Scott County and myself into Savage, we've continued that relationship. So I really say, collaborations and partnerships really stem from positive relationships that you can develop early on and then sustain them going forward. And through any kind of creativity, you can kind of address any major issue that comes forward.
Do you want to talk a little bit about SHIP Project?
Yeah, I can talk specifically to some of the SHIP partnerships that we have. We've recently become working more closely with libraries, specifically on more aging projects, some different kits for our libraries, different things along those lines. We also partner very closely with all of our school districts, different work sites across Scott County. These aren't specifically around aging, but kind of displays our partnership across the entire community. We in active living, we have provided different outdoor play opportunities for childcare facilities and our Scott County school districts, different school physical activity projects around implementing new equipment for recess and physical education classes. We've worked specifically with our Worksite Wellness Collaborative and different partners to implement different fitness rooms, treadmills, and standing desks, and different on-site employee gardens. We've also worked with the city of Shakopee to support older adults on different gardening classes, gardening projects to get them active in alternative ways, as well as different exercise and class opportunities with the city of Shakopee. We have worked with the city of Shakopee as well on implementing a fitness court at Scenic Heights Park, which was a big partnership across many different partners to make that project possible. And then maybe I'll end with kind of going back to the libraries and expanding on their library of things type of projects with implementing more physical activity equipment in their rentals. So things like snowshoes, pickleball nets and paddles, different gardening equipment to be rented out to residents within the community. Yeah, I think that's where I'll end.
I can add with the library to things. It's been a great collaboration between SHIP and the parks. Like Casey mentioned, we have the pickleball nets. We have, in the winter, we have snowshoes of varying sizes. So you can get children, you can get kind of teens, you can get adults. We have a camping tent you can check out to go and use that. But another thing that we do as a partnership is we have the Readmobile that will go out to where people are. We partnered with the parks and we went to Canterbury and we went to their furlong program where the children and families of the racehorses who aren't always in stable schooling and everything, we went out there and did a partnership program with the parks and the library to be able to have them check out materials and different things like that, which has been really fun. We also are currently partnering with, once again, the park program to do a Moonlight Magic with yoga and then the library coming in and doing stories, and we are aiming it towards those adults who are looking for active environments within the parks.
And I could just add, I know we're going down the line, sorry. I just add some of the strength in the collaboration and the partnerships has enabled us to leverage additional dollars, which is really critical. For example, Casey mentioned the fitness court that took a lot of partners to get going, but it also, a lot of partners threw in some dollars in the hat. And I know Kelsey, unfortunately, wasn't able to be here today from the city of Shakopee, pardon me, and she would also talk about the fitness court and edible landscapes, which was started off with some funding with SHIP dollars. But we were also able to apply for a GUSNIP grant, is that what it's called? Which was a really large amount of money in partnership with the ARB and Carver County. So really, it just has been, the strength of all the partners at the table has enabled us to be creative and expand some of this work.
One thing with the parks that I'd like to add in is that by working with libraries and SHIP, one of the things that's helped us do is it really helps bring our organizations together. A lot of times we're doing a really great job reaching our own audiences, and we all have different infrastructures that can support these different groups. But when we start to allow partners in, it can also help us align our goals so that we can collectively work towards reaching these groups. One of the great examples that I think I wanted to just touch on a little bit is by working with SHIP and the grants, we were able to, this past summer, make a stronger connection with the senior center out in Prior Lake. And as a result, we found that the senior centers were really looking forward to having this regular walking program that started on just Mondays. It was only supposed to be lasting about a month, but somehow it is still going. And it's because we've really created a culture that now they want, this is their identity. They want to come out and have this safe walking place, nice paved trails in the regional parks. And they do that continuously on the Mondays. And that group would have not have been formed had it not been allowed the SHIP funds to come in and help support that, or the partnerships that we've made with the senior centers. So those are just ways that we can see that these efforts that we're putting towards this programming have lasting impacts, and now it doesn't need to be staff run because it is its own independent group that's just continuing to go forward.
All right, if we can jump to page 14. The chart is the percent of residents who believe overweight adults and children is a major or moderate concern. Showing 2025 is at 62%, one of the highest of all the years dating back to 2011. How do you communicate progress or successes in this area back to the residents who are concerned?
Well, that's an interesting question. Thank you for asking that. I'm not sure we do specifically related to this, but we do, when we do the community health assessment, which we're just completing, we do that every 5 years. We do a report on that. That report is available to the public. We also are going to be doing an article in the resident report on the community health assessment, a couple pages that will include some of that data. Mostly at that point, it's just going to be where we are at as far as data. We also are working on a forward-facing, client-faced dashboard for residents to be able to look up the results of the community health assessment. This particular data is from the resident survey, so that Lisa Cohn. Oh, there you are. There you are. I'm not sure if you want to add in how you talk about or release information on the citizen survey.
Thank you. Thank you, Lisa. Yes, we actually make sure that people are aware that we post the last several reports of the citizen survey results online. And for those of you watching at home, you can find that on our website under Government Transparency.
Thank you. We also work on a community plan called the Community Health Improvement Plan. We're required to do that also every 5 years and update it annually and talk about our outcomes related to that annually. And that is also posted on our website and submitted to the Department of Health.
On the next page, page 15, you have a chart listing out Scott County births going back to 2000. Can you talk about how this connects with your topic today and why it's important?
Certainly. Well, this chart as well as the one on the next page, it's all tied together, but it's very interesting because we see, and it's clear that Scott County births are decreasing over time. There's a lot of reasons for this. This is not just related to Scott County, it's across the United States. And there's a variety of reasons why the birth rate goes down, including an increase in economic uncertainty, rising costs of raising children. There's been a trend to delay marriage as well as childbirth. And the population is aging. There is some good news, though, that impact the birth rate. For example, teen birth rate in 1991 was about 62 per 1,000. Now, in 2021, it's 14 per 1,000. So that's good news. But that will also impact that. People are delaying and putting off marriage and childbirth, which will definitely tend to change the makeup of the population. At the same time, people are aging and people are aging and staying in their homes and in community longer. You can see also that in chart 17, the percent of the seniors in the population has nearly doubled over the same time period. So this data point is important to take a look at who's in your community and what the community trends are and what you need to do. Like in 10 years, that trend is still going to continue. So what planning needs to happen in your community as far as schools and trails and senior housing, et cetera. And that's really kind of some of the different trends that we were looking at when we put this packet together. Does anybody else want to add to that?
I just wanted to comment on that as the department that issues the birth certificates. That I actually went back to look and see if we had data from 2000 to see if we could see if we were trending along the same pattern for the issuance of birth certificates. And, of course, we don't have data back quite that far. But it is, that was definitely, I'm glad you brought that up, that was definitely something fascinating to me. And to be honest, the aging population is one thing that I really didn't take into consideration, so this really had an impact on me, so thank you. I have a question about page 26. And actually, I think a lot of your charts are sort of related in this category right here. Maybe we could go to 28. I'm sorry. Something really jumped out at me as I will borrow something from Commissioner Beer's comments this morning about not my pants getting tight necessarily, but as I'm feeling middle-aged these days.
Thanks for that reminder.
You're welcome. Anytime. I was wondering if you could tell us more why the data shows that the 35 to 54, like middle-aged, I hate to think of myself as middle-aged, but there I am, are getting less physical activity than other age groups. Do we have any insight into that, and also how we can improve that?
One thought that I initially have is that this 35 to 54 age group is traditionally like the sandwich generation, where they might be raising children and being a primary caregiver for older adults or their parents as well. So that could be some indicators as to why there's maybe less time for physical activity, there's less access or opportunities in that regard, whereas maybe older adults are retired and have more time for that type of priority. Can you repeat the second part of your question?
Oh, absolutely. I just wondered how we could improve this. What kind of supports do you think are out there for this age group that might improve this?
Yeah, I think weaving in some of that age-friendly work into all of the things that we're doing, so access to trails and safe roads and sidewalks is obviously a priority for older adults. However, as we go through the lifespan, it's also very important for middle-aged adults as well. So kind of weaving in all of those aspects. So even if they are more focused on older adults, or we speak more to them when we think of older adults, weaving that into how we design our communities is important. I don't know if anyone else has more thoughts on that.
Yeah, I would just add, I think that, I can really speak to the sandwich generation thing, and I was actually going to mention that. And I would say, my husband and I have missed our daily walks in the last 2 weeks because of managing the teens and the grown-ups. So I think about this a lot, but even before I found myself in that sandwich generation, we always knew there was a point in time when we look at our parks data where people aren't participating, and a lot of it's about awareness. But I think a lot of it is just that it needs to be incredibly easy. And certainly it's easy if you know where the trails are and you just want to do it on your own. But in terms of like our programming, that sometimes can help encourage people to go and do something in groups. If you have to plan ahead, find the class, find the schedule, make an account, register. These are barriers, and I think that having options for drop-in programming could be great. I don't have data that indicates this, but just sort of based on my own life experience and maybe some anecdotal things, I think the more we can do that, and also make people aware that they can just have that drop-in stuff, I think that might be one little thing we can do for that group.
I would agree. Speaking as a member of the older part of that middle-aged group, personal information, but just observational and some data that we've been collecting of use, that drop-in use has been tremendous. We have 12 pickleball courts. That is our prime target demographic, is this specific age group, because it is something that is free. They can come and go as they choose. They don't have to register. That is something we have found in our data that we've collected that says people don't want to sign up. They don't want to have to plan ahead 3 weeks in advance. They want to drop and go. The other side of this is that we're trying to align programming or opportunity alongside of each other. What I mean by that is playgrounds are typically designed for young children, but what is the parent doing while that child is playing on the playground? Can they participate with that child on the playground? Is it something that they could do together? Or do we put exercise equipment next to that playground so that they can sit and do a recumbent bicycle while their kid is playing on the playground? A really concrete example is at Hidden Valley Park in Savage. We have a trail that is a wonderful walking trail. Well, we had a group of volunteers who decided to put an obstacle course next to the trail. So as the parents are walking, the children can go play and climb, and they're not bored and are we done yet and all that kind of stuff. The parent can continue to go and the child can climb all over the obstacle course. It has been wildly successful. And again, that kind of non-structured play, we have a nature wilderness play area that is total free play. Just come in and build what you want, play in the leaves, do what you need to do. We have seen a tremendous uptick in the use of that park simply because it gets people more active together, not just specifically on their own.
I would also add that in this age group, 35 to 54, ever since COVID, the trend has been a lot of working from home. And you have this, and it's particularly for this age group. A lot of them like to work from home, but the flip side of that is it increases to social isolation. So they're sitting at home, they're in their office, they have no contact except through the computer, and a lot of them also game online. So they're spending their entire day connected to the computer and are not really interacting on a face-to-face. And I think that definitely contributes to that loneliness and the feeling of social isolation. So it really is targeting, like pickleball, that is a newer sport that really does target this generation and hopefully gets them to unplug and to get outside and to get physically active. The other things we're doing also, like community gardening, yes, it gives you access to healthy foods, but also is that, particularly for seniors too, but it also gives them the opportunity to connect with other people, and looking for like multi-use playgrounds where we have the fitness court next to the playground, next to the edible landscapes. You're going to be able to have opportunities there to interact with human beings on a face-to-face level.
I also want to piggyback off of what Greg was talking about, and really when you're looking at multi-generational programming and families, it can become really quite difficult. How do you get somebody that's going to be out in the park saying, hey, I want to go do a kayaking program, but they have to watch their 3-year-old. So are they going to get a babysitter? Are they going to bring them with? So our approach is also trying to make sure that we have a variety of programs that offer opportunities for multi-generational programming. And some of the things that we offer here in some of our regional parks are kick sledding. Instead of doing individual sledding, now you can go and do that with your child, or boat rentals or scavenger hunts. All of those allow for families to come out. This past summer, we actually had a senior barbecue out at Prior Lake, and we actually saw, for the first time, 3 generations of families show up, all from for one program, and that was a big win for us because we're starting to realize, how do we reach these individuals? How do we keep them engaged within the parks?
I have a question about pages 36 and 37. It's a little more demographic related. We've talked about this a lot, about the aging population within Scott County, and this is showing us older adult population growth by city. I'm sure we've had other conversations about this in other meetings and so on, but I'm curious from this group if you have any insight or suggestions for why we might be seeing a rise in older adult populations in some cities and a decline in some others.
I could probably speculate for a couple of them. When you have, and we also included, some of them are smaller, so going from 2% to 6% seems like a big jump, but that's really 304 people. But that could just be one senior complex being built. And for the smaller populations, it will make a significant difference. And again, our population is aging, depending on what some of the amenities are in the community. It could be attracting seniors, not just for living facilities, but also if there's a senior center there, or there's opportunities for for seniors to interact. Does anybody else want to address?
Well, I was just going to mention, is it the city of Jordan that has trends towards a younger population, so that could be offsetting the older population? Yeah.
Recently, the city of Savage completed our Parks Master Plan, and in that, we did a tremendous amount of demographic work. What we found through the public engagement we did and some of the research our consultants did for us is that where families are living, they are bringing their parents close by. So to have that proximity, and I think Lisa addressed it, when a facility comes open, that drives the market to build that facility so that the parent can be close by or that older adult could be close by. I know for my personal situation, it'd be great if mom was just around the corner so that I could spend more time with her, that type of a thing. So we really see that as one of the major pushes, is that bringing older adults either into our community, or in Savage in particular, we are an older community and we've been around a long time. People love our community. They don't want to leave. They want to age in place. I'm a classic example. I've been in Savage for 30 years. I still live in the same home. The kids have flown the coop. They're not there anymore. I don't really want to leave that community. So we see that as housing type changes, we're seeing people staying in our community longer because we're addressing their needs. And then from a park standpoint, we need to really stay on top of that. One of the things Lisa and I were chatting about before was, how do we define who these older adults are and what are their needs? They have vastly changed over the years. Of when we think about retirement just as one indicator of getting older, retirement means, oh, you're going to go fishing and that's all you're going to do and that's it. No, there's active involvement in raising grandchildren. There's active involvement in staying active yourself. What you're looking for in your community is changing. So as our community has grown and aged, we have to change and evolve with them.
All right. I want to jump to page 19. This talks about, it's a chart showing the residents' rating of regional parks and trails. Just seeing back all the 2004, this has been a strong measure for several years. How do you balance the need to maintain these high quality facilities with the need to also expand access and make improvements?
Oh, that's me. Very carefully. I think there's sort of a continual dialogue with the community, with the county board. I would say the comp plan often is sort of a point in time where we look at, are we balancing that? So when we go through that comp plan process, we really reach out to the community. We have lots of strategic conversations with leadership at the county and then our county board and our Parks Advisory Commission. And then history has shown that we set sort of this 5 to 10 year vision, and we look at where are we providing service in the community, and does there need to be an expansion in terms of infrastructure or operations and maintenance or programming. So I would say that it involves those three groups, the community, staff, and the board, and we have those conversations at specific milestones. That's sort of how it happens, and then we just look at data from resident surveys. We get ongoing community conversations with different planning projects, with our development projects, and we hear from the community if there are sort of challenge points. Working with our partners, we're hearing things, maybe there's a gap in serving aging adults, or to Commissioner Brennan's earlier point, is there a gap in the way that we're supporting folks that have a need for adaptive participation in our programs. So just sort of an ongoing dialogue with different groups where we can discover, are there sort of gap areas or challenge areas that we need to address. Thanks.
I was wondering if you could go to page 33. This is a chart that tells us about the Reminisce participants by location. And Julie, if you wouldn't mind maybe briefly explaining the program and then telling us what does this data tell you about this work, and are there any opportunities for future services?
Yes, absolutely. So the Reminisce program is something that was started within the libraries. It actually was started by a conversation of some residents from Phillips Square, which is an independent living facility for 55 older in New Prague, about how they don't always have time to come to the library. Can we bring books to the library or to them so that they can have sort of a library to use service? But then also they were finding they weren't finding connection within their own community for Phillips Square, but also New Prague. So we're like, let's do a program. So what we do is we go and meet them where they are. We go right to their activity dining room area, and we host games. We bring a wagon full of books that they get to browse the books, similar to a library situation. They can put in requests. They're actually now going to start a book club there. So we will now be bringing book club kits for them to find people to join and find more connection within that, which is really fun. We have since expanded, and we are now in another facility who does memory care, and we are able to provide resources such as some of the kits that we've worked with SHIP, with dementia, Alzheimer's activities, things like that, but also providing them more of an art-based program and library resources with those. Yes, what's been really great is that our numbers just keep getting bigger, which is awesome. It started out kind of small with only a few people showing up. As you can see, it was 9. We did have a slight decline in December because of holidays. So all their family members were there. But then every time I get new residents, I get people stopping in just for the books. I get people coming in for games. We are now finding that they are having their family members bring them to the library, which is even better because they are now coming into the library. We get to meet more of their family members. And yeah, I was like, was there a second part to the question that I missed?
Any opportunity for future services?
We are looking into that. It is a goal for the winter, especially as we move into our winter reads program, which is our adult reading program. So with an adult night out, but also looking to expand into some of the other facilities and communities in other Scott County cities. So.
I sort of have a marketing question that's loosely affiliated with many of your areas. Do you have groups that you'd like to reach, but you really haven't been able to? Any ideas about how to reach those groups of people?
I know one thing we're looking at is how do we reach the aging population? Right now, there is a lot of advertisement on social media, which is not always the spot that they are. And then with not every community having a strong newspaper, which is where they would find their advertisements and event listings. So that is something the library and my team in general, we're always talking about where can we market and who can we meet. But that is one demographic that we are really kind of focusing in on at the moment.
I'd say probably the same for our SHIP team. We're kind of focusing more on aging adults and kind of finding those partnerships amongst both libraries and parks and kind of using our resources collaboratively together to reach this demographic.
Right, and that's, what is the county's role? Previously asked, part of it is through our community health assessment, which we have completed now, and that's part of our statutory requirements, and it really is to get an idea of what's happening in the community. If we're looking at page 26, I think it's the one on adults reporting any physical activity in the past 30 days. This data actually was really quite surprising because we've been thinking we need to target certain groups, but this is kind of the interesting data because we discovered through our community health assessment that the 65 and older are the ones that are reporting the highest physical activity. And we were thinking the opposite, that we really need to market to them, we need to find opportunities for them, but they're the most physically active, followed by the 55 to 64-year-olds. But part of our job is to look at, well, how is that split by age, by income, by race, and we discovered through this data that Hispanic Latino, only 55% are reporting physical activity. So that's telling us we need to do a better job reaching those populations and identifying what are the barriers, what are the gaps. And once we get that information, do a little bit of a deeper dive through our focus groups, is to identify and ask them, how do you want to be, like, what is the method that you're using? Who are your trusted messengers? How do you find out the information? How do you want to find out this information? And try and match the needs of the communities that we're trying to reach with marketing. We don't have any dedicated marketing people in public health. We're trying to work on some creative solutions there, but how do we engage our partners in helping spread those messages out and really trying to build some capacity in the community for that?
It sounds like there's a lot of good, thoughtful planning going into this. And we've talked about a variety of different programming, demographics. And I'm curious if you have any thoughts around any specific, or like, what are the metrics or indicators that would be most important for us to be looking at over the next 5-10 years as we think about active living in the aging population?
I think it'll be interesting to watch if the aging report that Public Health did, or SHIP, really showed that it seems like our older adults seem to be doing comparatively well. And I think it'll be interesting to watch to see how that progresses. And obviously, I think that we all are aware of that report, and one of our strategies is to help shepherd that that population continues to be comparatively healthy. But that will be interesting. And I think I'd like to understand more about why that is. And we've talked about some of it here. Maybe there's more opportunity for that age group to have more time to be engaged in keeping healthy. But I'm kind of intrigued with that whole piece of it.
And I think the demographics of the shifting population to an elder population is an incredibly important metric. I think as we're starting to shift into comp planning. We'll be providing some support from public health through comp planning and community engagement. But your demographics of the population really needs to be at the forefront as you're doing your planning. Even just thinking about, do we need sidewalks in the community? Well, when you have a very senior population or an aging senior population, you're going to want to have sidewalks in the community, because if they want to be physically active, we don't really want them walking on the street, particularly in the winter. I mean, these are all different things that people need to keep in consideration. So I definitely think that is a very key metric, and both cities and counties need to have that at the forefront of their planning.
I think about my sister would never forgive me for saying this, but she just turned 65. Your 65-year-old today is not your 65-year-old from 30, 40 years ago, right? We think about watching the Golden Girls back in the 80s, and they were mostly in their 40s, right? I mean, it's just so different. The environment is different today, so.
I definitely agree with that, being almost in that. I would also say that it's, again, the county's role offering up opportunities. We want people to live healthy. We want them to be in their homes longer. We want them to stay in the community. And active 55-year-olds are typically active 65-year-olds, are typically active 75-year-olds. And the more we can engage that sandwich generation and offer opportunities and find out what the barriers are for the aging population and trying to reduce those barriers, they can live healthier and more and longer in the community and be more independent. I mean, that's the other piece that we're hoping to get to, is providing them opportunities to be independent and not rely on county services.
So speaking of those metrics, a piece that I think might play into that a little bit is safety. Page 21 has a chart that's the residents' rating of safety in Scott County parks and trails. Just seeing that the perceptions of safety has improved slightly, with 44% of residents now saying that they feel very safe. What factors do you think contribute to that shift, and how can you continue to build on it?
Sure. Well, first, I think perception of safety is so important. So I think that this measure is the resident survey. So people who are being asked this question aren't necessarily going to the parks. So, it's important that the people using the parks are feeling safe, but then that there's a perception in the community, because if the perception is that they're not safe, the people who are not using the park certainly are not going to come. I think, just basic things like having things very, very clean and trash picked up and well maintained. I think having, smiling staff that are willing to just say good morning and say hello really brings a sense of safety. We work in our extended parks team, which is Three Rivers and Scott County employees, to really pay attention to those things. So greeting people. We have our patrol team who partners with the sheriff's office, and they're out there, and they can write ordinance tickets, but they're actually out there. Their primary role is to say hello to people, ask if they need help. So really, those are things we really pay attention to. So I hope that those are some of the things that are feeding into this measure. But we do really pay attention to this measure quite closely, yeah.
Patty, I also might want to add, and feel free to jump in too, is that we discovered within one of our walking groups is that we actually had a participant who wanted to go for walks in the parks and trails, but just didn't feel comfortable herself with her age being able to do that alone. And by that, what I'm referring to is what if she got too tired? What if she had something medical come up, and having that companion or that group that she can go walk with ever since her husband passed has opened up the ability for her to feel confident in a group, saying, if something was to happen to me, there are people around me that have my best interest that can help get me the resources I need. So understanding that was a huge part of it.
With respect to time, I'd like to offer if any of the panelists have anything they'd like to share before we turn it over to the commissioners for a couple more questions. All right. Mr. Chair and Commissioners, if you have any questions.
Thank you very much. I just want to start off by saying our parks and trails, they're gems. And I need to use them more. Not because my pants are tight, but, well, definitely because of that, but they're such gems. I need to get out there and use them more. For a whole lot of reasons. It's like a little slice of up north, just to the south. Okay, question,
Can I
yes.
ask just quick, I don't know what page, it might have been 17, the birth rate, and who was it? Was it Lisa? Yeah. Is that typical on the ring counties like Carver or some of Dakota? Is that, the birth rate? I think it said 10 per thousand or something, or was that, so 1 per 100? That's almost a suicide mission, if you extrapolate that out 40 or 50 or 100 years, right?
Yep.
Thank you.
There'll be less people and less people here.
That is correct, Commissioner. It's a nationwide trend,
Okay.
that the birth rate is declining.
So it's not just the rings, they kind of move out and people turn older, and then it's now New Prague and Jordan, those places are gonna be the next.
No, it is nationwide across the US. It's a lot of shifting of priorities generationally, but it is also, if you map out the birth rate and then overlay the economy, it's very connected to the economy. So as our economy strengthens, you tend to see the birth rate increasing. So it is very cyclical, and there's a lot of things that drive that. But overall, birth rate has been going down. And a lot of it is just different generational priorities. And the biggest impact has been that, when my parents were in their 20s when they had children. Now parents are in their 30s and even later into their late 30s they're having children. So that will also drive that as well. And people are having less children than we used to.
Do you think video games has anything to do with it? I'm serious.
Like the birth rate?
Just seriously, there's a lot of people. What?
Yeah.
I'm blaming them for everything.
Yes. I
They
like
have
it.
it in the basement. I think the parents sometimes don't even know the kids are down there for 20 years playing video games.
More meatloaf.
I'm sorry, more meatloaf.
I'm not sure the answer to that, Commissioner Wolf. I can do some research though and identify if video games are impacting
I could do some
the
too, and
birth
I'll
rate.
just make it up from the internet.
You may have something there. I think that staying in your home and just gaming all day and working at home, you're gonna have less social interaction and less face-to-face contact, and we kind of know that the birth rate, you need to have face-to-face contact.
Well, 'cause
So
some
there
of-
could be some.
Some of my
connection.
kids have friends that are still sitting at home playing video games and they're looking for a job. I'm like, what? I don't think they're looking for a job. Anyhow, okay, that's it.
I like it. We might go viral after all.
Okay.
I have
I'm
a few
done.
comments, Mr. Chair.
Okay.
Thank you, thank you. One thing I wanted to say that I'm challenging a little bit on Facebook. I do think older adults are using Facebook a ton, and it's just to make sure how to find them. I mean, none of my kids use middle-aged and older people tend to use Facebook now, so I think sometimes we just say we're not gonna reach older adults with that. We need to figure out why not, because I do think if we look at the stats, especially in the last year or two, of who uses certain social media platforms, it is aging specifically. So just a thought out there, a thought for conversation even maybe. Thomas, about your anecdotes about the folks thinking about walking alone in parks and stuff, I just really think, and you're probably way ahead of me on this, but there's some real opportunity for some organized volunteer opportunities through our volunteer coordination for things like that. I could see folks who that's something they'd be willing to volunteer to do. Like, yeah, I can just go on a walk with a group of people and call help if need to and be a companion. So I encourage us to think about if there's some opportunities there. And then finally, Greg, thanks for being here. I know all of you, a lot of us work with the cities pretty closely, and almost all of our cities have some kind of Parks and Recreation department. And I guess I just wondered a little bit of comment about how we continue to build those relationships and make sure we're using resources most efficiently and not duplicating. Because sometimes we see that, as we just see that we have our own agencies, organizations, funding goals, and then it'll be like, whoa, these organizations in Shakopee are doing the same kind of thing on the same day in Scott County. Thoughts on that?
Mr. Chair, Commissioner, I would agree wholeheartedly, and I think that's a lot about building relationships with the people who are delivering those services. In Savage, for example, we have 4 school districts, 3 school districts that provide programming or actual services to our residents. If we don't have those active conversations about, very simply, when's your Halloween party versus when's our Halloween party, we could be duplicating that exact day. In fact, we found ourselves in that situation about 5 years ago. We worked to complement each other now versus compete with each other. And I think that is just one small piece of the pie. There is a ton of examples that we could use about why those collaborations and partnerships are so important. For us in Savage, we have Murphy Hanrahan Park. It's right there. I mean, getting our residents to know that that park is available for them as well, not just, well, that's not for us, that's not Savage. Well, yes, it is Savage, and yes, it is Scott County, and you belong here. And it's really coordinating that communication that I think helps really well.
I'd almost be interested, I think all the fire chiefs in Scott County and police chief, people have quarterly or more often meetings. It'd be great for our park staff to do that, because I think that there could be we're really gonna focus on walking with older adults. Well, it lets somebody else free up some resources and refer their folks there. So I would really encourage that.
Mr. Chair, Commissioner, thank you for that, because we do have some of that already. The City of Savage, in collaboration with Shakopee Prior Lake and many of our Dakota County partners, have what's called the South of the River Recreators. That has been an organization relatively informal now compared to what it was in the past, but we get together and collaborate consistently on about a quarterly basis. We get together to talk. We're also part of the Minnesota Recreation and Park Association, and that's where Patty and I have connected over the years and really established that. But I agree, having more of that centralized focus on our Scott County communities in Parks and Recreation would be a great thing for us to do.
Cool, thank you.
I think I'm running out of time, so I'll ask really quick, and this is probably a really big question, but I was really recently in a meeting with some of our cities in the SMSC And one of the topics that came up was safety with e-bikes and on the trails and in the parks. Is that something that is a concern in your area, and is that something that we should be talking about more?
Thank you for that question, Commissioner. The e-bikes, that has been an ongoing discussion that we've had with both cities and the Park District. And then also it's even come up at the Met Council as well too, on talking about how do we keep our communities safe and how do we make sure that the community is educated about these vehicles that are now entering our streets. We did recently have a conversation with both Shakopee and Prior Lake to try to better understand, because we knew that they were making some pretty good grounds with e-bikes and how do they educate. And we believe that's really where we first want to start if we were to go down this path of e-bikes, is how do we make sure that we're educating parents. And both Shakopee and Prior Lake this year started with their schools, and they made a relationship there, and they said that students aren't allowed to take e-bikes or vehicles to school anymore. And that started raising the question to the parents is, well, why? And it got the parents talking about, hey, they're dangerous, there's age restrictions, there's lots of limitations. And they actually have said that they saw an improvement within those communities. Now it's still early on as they just started that, but we're looking at that as an example of, are these things that we can incorporate in other locations? One thing that they did reach out and ask and mention is that it would be great to see some new signage or educational opportunities on the regional trails or in other communities that talk about and inform parents, hey, what is a class 1, 2, or 3 bicycle when it relation to e-vehicles? And that knowing that is important.
Mm-hmm. Yeah.
Okay. Thank you.
Just, I was thinking about this aging society issue, and there are dynamics that I don't think are just jump out that cause part of this aging society dynamic in an area or county. Housing costs is one, affects aging society. If the housing is very expensive, that limits the young people coming in, or the type of housing stock that's being built. If you're building $500,000 or $600,000 townhomes, that's not going to encourage young people to come in. Or interest rate, high interest rate affects the aging. It's a lot of the work of the CDA. I think, if you said, well, through the CDA, we'd like to grow a younger group, interest rate buy down, down payment assistance, building housing stock that would attract younger people. Actually, the crazy thing, if you build more senior housing, your age will go down, because a senior will move into a senior housing, but 3 or 4 people will move into that house that just got sold. So your county would get younger those ways. So it's some of those dynamics that it just isn't apparent how those affect the aging of a county. And so I was kind of interested that the Latino not exercising as much as other groups, that also could be a different dynamic. You'd have to know what is a primary age, or is there an age range that in that demographic, are those younger Latino families with maybe larger families? I mean, they probably, I can visualize a scenario where they get home from work and the family's all together. Who's going to leave and go exercise? Or, it's like there's dynamics that you might have to be more aware of. What is the actual factor there? I don't know. So those are some of the things that affect trends, I think.
Mm-hmm. Yeah, can you go back to the birth rate slide? But it's also along the same route, to your point. A lot of the stuff, I think you talked about, who answers some of these questions, do they even go to the parks if they feel safe? Or this one, drill down, like what else is happening in some of these, we're seeing bar charts. But this one, I know we're talking parks. Every time I see this, I often wonder, like, what's the why? Is it just economics, which I think is a big part of it? Then I would love to see this drilled down, even for the parks. Like, what is are all demographics, are all groups following this trend? I know it's a national trend, I know it's a county trend. Are we collectively, we, not just Scott County, but contributing to this somehow by making it harder for people to, live lives and have kids and affordable housing and just affordable, anything. You hear government entities, not necessarily this one, talk about, oh, we need affordable, but then we jack up the taxes. So it's like, well, which one are you incongruent? Like, what are we talking about here? Again, I know we're coming back to parks, but this one gets me going. But even as it relates to parks, I would love to see this one broken down more. I know every time we talk about it in different settings, it'd be fun to see this broken down in more detail. So, question for another day, maybe.
Mr. Chair, which chart are we talking about?
The population, like, what's contributing to this? Is this, like, the last slide we just happened to look at, different, could you go back to that?
Birth rate.
The birth rate?
Yeah, no, the exercise, exercise by population. Like, this is sort of I know, again, we're talking about parks, but I always talk about this too. If we're breaking things down by age, by race, by whatever, let's keep that consistent throughout the graphs where it can be transferable, just because then you're keeping apples and oranges, so to speak, a little bit more definitive and makes it not easier, but more able to make decisions if we're making decisions on stuff like this. So. But since we're talking about parks, I do double down, and we have some great ones. We have some gems that I am going to, that's my encouragement to myself and others, to get out and use more. Leslie, you should use those parks more often because you're unfamiliar with them.
I expect to see you tomorrow at Cleary Lake at 4:15.
Oh, boy, the gauntlet has been laid down. And I can only say that comment because she's like been to every state park, county park, national park, probably world park. I don't know if that's a thing, but I'll look for stickers on her Maverick and see. All right, any other questions on this? Otherwise, thank you so much for this. Being good stewards of what we've been given, and get out, folks, and use our nice little slice of up north right here in our own county. So thank you very much.